clinical profile. She, let me put my glasses on so I can read her bio. Vanity is something else, right? Okay. She has a winning combination of board certification with 20 years of clinical practice experience with ophthalmology, academic um, academic teaching positions at 3 universities, an award recipient and CEO of a non-profit organization. She specializes in comprehensive ophthalmology, including management of glaucoma, diabetic retinal, she'll pronounce that, and advanced cataract surgery. So I'm going to turn it over to Dr. Barbour. Welcome.
Hello, welcome everyone. I'm so honored to be here, and I see a lot of familiar faces, so welcome. And again, I'm pleased. I'm going to share my screen with you so that we can get started on this lively topic of happy and healthy vision 2021. So a lot of you may be thinking, what is this talk going to be about? Well, we're going to take a whirlwind tour of ophthalmology and what that's all about, what I do as a specialist, and where things are going in the future as well. And we're going to take a look at some things that are current right now as well. So I just want to let you know that the little icon here, that's my office is called Clearview Eye Center, and I'm located down in Lake Worth, Florida. So let's get going. I have some financial disclosures that went kind of fast, and those are the financial disclosures that I have to expose. So moving forward, these are just a couple of snapshots of me about the office. That's in the upper left corner here. I'm treating with a laser. This is me just about going into the operating room, and this is my superpower pose right there. I got involved with the community activism there, and you can see the other photo there as well in the office doing a procedure. Again, I'm board certified, I'm an ophthalmologist. I'm glaucoma fellowship trained also at Georgetown University in Washington, D.C., which is where I'm from. I am practicing in Lake Worth, and I've been here for about 20 years, a little over. I attended Howard University College of Medicine in Washington, D.C. And I also got my MD there, and I attended Florida Atlantic University, where I received a master's of health administration. I'm a proud member of Alpha Kappa Alpha sorority, and I am the CEO of the Smiles and Vision Foundation, which is my nonprofit arm of my practice. In 2014, I was voted one of the most influential women of Palm Beach County. And a little bit about my office. It's located in Lake Worth. Again, it's a state-of-the-art facility, 3,000 square feet. We have a dry eye spa, research center where we're focusing on diabetes and what it does to the eye. I'm also able to do minor surgery, office-based minor surgery. We have an optical center, so we do glasses, contact lenses, and we also have most up-to-date diagnostic equipment for all of your ophthalmic problems. So let's get into the talk. What is your vision for 2021? And I see, it looks like my auntie is here. That's wonderful. Aunt Gloria, how are you this morning or this afternoon? I think I missed your call, but welcome. Can you please share with the group at least one item that you may have in your vision for 2021? And you may have to unmute yourself if you're muted. Let's see. Are you able to speak?
Okay, I'm muted or unmuted.
Oh, there you are. Okay, yes.
Okay.
That's one item on your vision board.
Well, my vision board is to continue to be very vigilant about treating my dry eye diagnosis. I would slack off sometimes, and then I would have repercussions from that. So I have learned to take good care of my eyes, the only set of eyes that I have. And my niece takes very good care of me, and she's always very supportive. And I will continue to be vigilant about my dry eye care. Thank you so much.
Terrific. Thanks for your input. So I think what we're looking at is to get away from 2020 as far as we can. And some of you may have put your vision board together already. And whether it's a new car or a place to travel or a new house or a new hobby, the first thing that you've got to think of is keeping your eyes healthy enough and happy enough so that you can enjoy your vision for 2021. So let's get right into it. How do we keep our eyes healthy? I think the top 3 to 4 things here are making sure that you don't have glaucoma. That is the #1 cause of blindness, right behind cataracts for the African American population. And of course, there's a disparity. So please make sure you go for that annual screening for glaucoma. The other thing is, as my auntie mentioned, dry eye. Make sure you keep your eyes healthy by reducing your screen time. And we'll talk a little bit more in depth about that as well. Have an annual screening if you're diabetic for diabetic eye disease and for age-related eye disease as well. And of course, everyone has COVID-19 on their minds. And yes, COVID-19 can affect your eyes. So we'll talk a little bit about that. So those are the top things that I would think to help you keep your eyes healthy. And to keep your eyes happy, I think you want to see your best and feel your best about your eyes, not having those dry eye symptoms, and also have a youthful look about your eyes that appears happy as well. So we'll talk about those. Let's jump right in and talk about glaucoma. First of all, what is glaucoma? Well, it is dubbed as the sneak thief of sight because there are no symptoms. And basically, it's a progressive degeneration of the nerve of the eye, so much so that folks are going blind without any symptoms, no pain, and basically nothing to tell you that something is wrong. The only way that we can detect glaucoma is by having the patient come in for that annual dilated exam and checking the ocular pressure. Up to 19% of blindness in African Americans is caused by glaucoma. So it is one of the leading causes of blindness. Diabetics and hypertensives are also at risk. Glaucoma tends to run in families. And as a matter of fact, siblings have a 10-fold risk. It is an incurable disease. So once we discover that glaucoma exists, we usually treat it. And we treat it with eye drops, surgeries, and things like that to lower the pressure, which is the main focus of the treatment. Again, just to reiterate, nobody really knows what causes glaucoma, but it tends to run in families, genetics, high prevalence, African race, diabetic. And actually, if you have low blood pressure, this can be one of the problems with your eyes. Symptoms, again, little or no symptoms. Diagnostic testing is the only way that we can find out about it. It's done in the office. You come in, your eyes are completely dilated. There are some diagnostic tests that we do, visual fields. We check the pressure of the eye. And another thing that we discovered is the thickness of the front segment of your eye. If that is thin, it is known to be associated with an increased risk of glaucoma. Treatment goal, again, is to reduce the pressure of the eye, stabilize the loss of vision with medications, possibly lasers, and surgical intervention. The prognosis for glaucoma, some people have mild glaucoma, some people have severe glaucoma, but in most cases, it can progress to complete blindness. So that's what we want to prevent. How do we do that? We have to get people on board to come in and get their annual screening for glaucoma. So let's move on and talk about one of the biggest problems that exists right now. And that is everybody's online. Everybody's on a Zoom or Skype or some kind of telemedicine consultation. And when we spend that much time on the internet, on our phones, on our devices, there is a syndrome. It's called computer vision syndrome or digital eye strain. And it's caused by extended computer use or your electronic reading devices or cell phone usage. And I see a lot of patients, actually, they're coming in younger and younger. Even small children have cell phones tied to their strollers. And it puts them at risk for dry eyes. Their symptoms, typically blurry vision, the eyes are red, burning, there could be some light sensitivity, even headaches. And this is actually diagnosed on mostly on the history, but there are clinical findings as well. What we recommend in this case is to reduce your screen time as much as possible. If you can't, then you need to increase your blink rate so that you can reduce the symptoms of this bothersome problem. We actually came up with a rule in ophthalmology, and it's the 20-20 rule. Every 20 minutes, if you're on your computer or device, then every 20 minutes, you should be able to look at something far away. And if you look at this cartoon that I pulled up here, it's kind of cute. She's looking at Friday when it's time to take off for the weekend. So something like that can be useful. But take 20 minutes, every 20 minutes rather, and look at something that's more than 20 feet away for at least 20 seconds. And this will greatly reduce your propensity towards digital eye syndrome. The next thing we're going to talk about is reducing your sun exposure. And there are a lot of sun-related eye problems. And who can I call on here? Who likes to go to the beach? I see Sora Marcia there. And Sora Brenda. And I don't know if they are able to unmute themselves to comment on the last time that they went to the beach. Either one of you care to answer that? Okay.
Okay, I'll answer. I'll play along.
Okay, there you go.
My son is a marine biologist, so he's on the beach constantly. So I'm kind of far away, but I do go to the beach a lot, kind of tan and stuff like that. And I know for a fact that I cannot look at the sun straight with my eyes, and I have to not necessarily wear glasses, but I do, and try to not be a bad boy by trying to look at the sun straight up. I try not to look at water with the sun because it gives a nice shine bright. And now I guess I'll learn more from Dr. Barbour. Who'll tell me what I shouldn't be doing. Okay. All right. So I'll shut my mouth and let the doctor speak.
Thanks for your input, David. So exposure to the UV rays are actually can hurt your eyes in many, many ways. Eye cancers, those are things that we may not hear much about, but that is something that can happen after repeated exposure. And cataracts also can develop, accelerate the development of cataracts. What I see mostly here in South Florida is growths on or near the eye, on the white part of the eye. And you may have relatives or friends and family that have those growths on their eyes. And those are called pterygia or pinguecula. And it basically happens in patients that have outdoors occupations like landscapers. So we typically see those, and they are very difficult to treat. A pterygium, which you see here in the photo, is a growth of calcific degeneration, and it continuously grows. It can get as big as possible. It can get as big enough so that it covers the pupil. And when it gets that large, the patient's vision can be compromised. The risk factors, again, sun exposure, windy or sandy conditions, mostly the equatorial populations. As a matter of fact, patients or people that live in places like Barbados have up to 23% occurrence rate of pterygium. The symptoms is a bothersome kind of problem. It's chronic redness, the eyes are dry, blurry vision, of course, because it induces astigmatism, and irritation is the rule.
Can I
Treatment,
ask, oops, I was
yeah,
gonna ask a question.
please do,
Can that be removed by surgery?
Yes, it is removed by surgery, and there are wonderful options for this kind of surgery. It is well known that if you simply just remove this growth, it grows right back within a month. It can grow right back, especially if you're not protecting your eyes using 100% UV. The option that I encourage the most is removal all the way down to the base, followed by taking a small piece of tissue from the top part of the eye, which is normal, that I would then transplant to that space using a special kind of glue. So it is a highly technical surgery, but I do have a paper that I wrote on LinkedIn. You can access that, where I looked at 10 cases over time, and the recurrence rate was actually 0%. So I'm happy to report that the grafting surgery is the way to go when it comes to pterygium removal. So there's no other way to deal with it. There's no laser, there's no drop. It's surgical. Good question.
Well, thank you, Auntie Yvette, for telling her that. You've done a great job with your niece.
Thank you. So let's move on now to the encouraging you again to be healthy about your eye care. Annual screening for diabetic retinopathy. What is diabetic retinopathy? If the patient is diabetic, they should have their eyes checked at least once a year. Diabetes is, in fact, the leading cause of new blindness. I'm telling you, it is very, very much an epidemic. I would say diabetic retinopathy is about 46% more prevalent in African Americans than non-Hispanic whites. And there are about 8 million diabetics in America. So we have a crisis here. This disease is something that is affecting the blood flow inside the eye. So basically diabetes rips up the blood vessels. The blood vessels become leaky, incompetent. The vessel can no longer hold on to the protein and the other components of the blood. So it just leaks right out into your eye, into the center where the best, most, accurate vision is coming from. And that's what diabetic retinopathy is. It occurs typically after the patient has had diabetes for 10 years. The patients are usually on insulin. They have a high hemoglobin A1C. They're typically male, and they have a high systolic blood pressure as well. So those are the people that are most at risk. What does it present with? Sometimes people don't have symptoms, and sometimes they know that something is wrong. They have blurry vision. The vision can be distorted. They may come in with acute loss of vision as well. What do I see on examination? I see tiny blood splotches inside of the back of the eye. I can see the protein leakage. And the same thing that's going on inside the eye is going on inside of their kidneys and other organs. But just because I'm an ophthalmologist and I use a certain type of equipment, I can see those blood vessels in vivo. So up top here is a photo. I'm not sure how well you can see that, but this is a typical presentation of a diabetic retinopathy eye. And peculiarly enough, Mexican Americans are also affected with very high prevalence. Again, the symptoms, blurry vision, sudden loss of vision. How do we diagnose it? Patient typically comes in for complete dilated exam, and they're usually recommended by their primary care physicians to come in, but some people don't come in. So it's very important. If you have friends and family, encourage them to come in and get that annual screening. The goal when we see this problem is to try to reverse it. And a lot of times it's too late to reverse it. So we just try and stop it where it is so that it doesn't make the person completely blind. Overall, the most important thing that these patients can do is to reduce their hemoglobin A1C so that it is consistently under 7. If we can't do that, and if this disease progresses, we have a number of treatments. What I usually start with when I see this problem is injectable medications. These medications are injected directly into the eye. Nobody likes to experience that, but it is the standard at this time. Sometimes the injection can be combined with laser treatments. If the patient progresses to a detachment of the retina or a hemorrhage inside of the eye, which the eye could fill up with blood, then that requires even further, more aggressive intervention, like going inside the eye and removing the blood, applying more lasers, so forth and so on. The prognosis for diabetic retinopathy is not good. People are younger and younger, and it looks like there's going to be a generation of younger blind people because of diabetes. So I have taken it upon myself to get the word out through my nonprofit organization. I created an event called the 5K I Walk, I Run. And this year I was fortunate enough to have the sorority team up with my nonprofit organization to pull off the 5K and what we labeled it as Eyes on the Pearl. And we just had this event last month. It was a major, major success. I'm so happy to report. We had over 250 participants. The members supported the event by walking with a commemorative medal and a bib which had some of the vision verbiage on it. And these people who participated in the event were able to talk to friends and family and let them know that, hey, if you're diabetic, get your eyes checked, get a healthier lifestyle, healthier diet, get to your ideal body mass index by walking, by doing different activities, monitor and manage your blood sugar, and most importantly, get the A1C under 7. So that was a real highlight for us this year. And I see a lot of our sorority sisters are on this call, and they were the ones that participated as well. So it was a huge success. And I am also involved in a research study at my office right now, and we're looking at diabetic retinopathy and the effects of diabetes and patients who have had extensive laser treatments. We want to find out what is the extent of the blood flow to the retina on patients who have had laser treatments due to diabetic retinopathy. So I am deeply involved with this problem, and it's something that really crushes me when I see patients coming in younger and younger with this problem, and they didn't know that they were supposed to get their eyes checked. So please spread the word on diabetic retinopathy. Do we have any questions on that?
Of course, I'm going to be a hog. So since you now give me that latitude, and I'm an honorary AKA because I did your event last Saturday. We did all the
Awesome.
back office, so we made sure that you all were all on the Soros on the same page. But real quick though, Dr. Barbour, you give some very good information. I definitely need to talk with you offline because I don't want to hog up your presentation time. But we have a lot of Black men. I work with the 100 Black men of Greater Fort Lauderdale. And until I had this conversation, now that I'm listening to you talk, the importance of eye exam. Now, I do my eye exam. My company pays for it. A lot of people do not have insurance that look like us that can afford to have somebody like you or of that magnitude to teach them or to share with them what's going on. What can they do? What can be suggested? I mean, I appreciate the, by the way, I help nonprofits find grants for free. So we need to even talk that way. But the face of the matter is, how do we get the word out to our community? We talk about cancer for Black men. And again, these are just human issues that we don't address because in our community, it's not talked about. So I thank you for being a champion, Dr. Monique. I know it's not easy, but you know we appreciate all that you do. And I'll shut my mouth and let the ladies talk.
I think it's a very good issue, and that is why I created the nonprofit, so that we can have some involvement and encourage people to spread the word. And the nonprofit actually uh, is providing free screening services, particularly during the month of November, which is Diabetes Awareness Month and Diabetic Retinopathy Awareness Month. So I have been able to reach out through a couple of printed rather publications where I have taken a full page ad to notify people in the community that this service is available. And I'm working through some of the community partners that I have as well. And likewise, when patients come to the office and they have family members that are uninsured, they do ask about the services of the nonprofit. So I'm able to get them involved at that level, but certainly could use a hand in getting
Okay. Sign
those
me up.
in
Sign
need.
me up. Sign me up. I got you. I got you. Like I said, we'll take this offline. I got you.
Terrific.
Stop doing this to me, Keely. Every time I get on a call, I'm doing more work. Will you just cut this out? I'm not coming on your calls anymore. You get me doing more work.
Absolutely. So moving on, keeping your eyes healthy again. Everyone has COVID-19 on the tip of their tongue. Does it affect the eye? Absolutely. COVID-19 can cause eye infections, typically pink eye, which is what you're looking at right here. But for the most part, it is not something that is very commonly associated. It's not the presenting finding of COVID-19. However, it can be seen in up to 3% of the COVID-19 cases. Patients will present with redness, burning, discharge, poor response to the typical antibiotic that may have been prescribed. How do we treat it? We treat it palliatively. It's a viral pink eye, a viral conjunctivitis. We give steroid eye drops, some soothing, lubricating eye drops, and something to quell the inflammatory response. And by the time that we see patients who have had COVID-19 infections with a concomitant eye infection, I think they're on the opposite end of the curve. So we're not seeing them as a freshly developing eye infection or conjunctivitis case, as some of the other frontline workers may be seeing them. However, we still take the same precautions. So that's COVID-19 and the eye. So how do we talk about keeping your eyes happy now? So let's lighten it up a little bit and talk about LASIK surgery and cataract management. These are the things that are going to keep you happy, keep you seeing well, forming well, keeping your vision 2021 in sight. Dry eye spa, we can take care of your dry eye. There's a lot of people suffering with dry eyes. And keep your eyes looking youthful and looking happy as well. So LASIK, that's laser vision correction, is just what it is. It's using a laser to optimize your vision without glasses. And you can basically throw your glasses away after LASIK. If you're under 40, for example, if you're over 40, LASIK isn't really going to help because you will still need something for reading. So let's talk about the next best thing, and that is cataract surgery. What is a cataract? As you can see in the photo here, a cataract is the natural lens inside of your eye, which has just turned cloudy. And over time, this can happen as you're getting up in age. Various medications can cause cataracts, like steroids. Genetics plays a big part. You can see a cataract after trauma. And of course, there's diabetes again, which is associated with both cataract and glaucoma development. How does it present? Typically, with gradual loss of vision, painless. The vision's blurry and they cannot be corrected with glasses and contact lenses. So definitely, doc, something is not right. You come in, we do a complete dilated exam, and voila, we discover that you have a cataract. How is it treated? There's no other way to treat it except by removing it. And the surgery to remove cataracts now is, I have to tell you, it's seamless. It's so beautiful. It's the most high-tech procedure that I'm able to perform. And we have so many wonderful options. That's a picture of me there operating in the OR, probably doing a cataract surgery. So what we do is we remove the cataract. It's done by ultrasound. And there's an ultrasound that shatters the cataract and aspirates it at the same time. And then an implant is put in place of your own natural lens. That implant is capable of replacing the lens and having your vision in focus for distance, should you choose a basic implant, or for all focal distances, should you choose the multifocal implant. There's a picture, let me go back 1 second. There's a picture here of the multifocal implant, which is called Technis. So it has several rings inside that allow you to read, see your phone, see your computer, drive, go to the movies, everything without glasses. Now, if you have astigmatism, and a lot of you may not understand what that is, but it simply means that with your glasses, you were using a lens that corrected your vision, that had different powers going in different directions. If you have astigmatism, that needs to be corrected also so that you can optimize your vision. And we can use a laser now with cataract surgery, laser assisted cataract removal. The laser is like a robot, believe it or not. And it's probably, I would say, almost as good as my hands, but it can chop up the cataract for me. It can correct your astigmatism. It can make certain cutting patterns on your eye with the precision of a robot. So it is widely available. I perform that kind of surgery, and the whole thing takes about 10 minutes. Can you believe that? 10 minutes, and you can throw your glasses away for good. So
Dr. Barbour,
something to think about. Yes.
does cataract surgery always come with an implant?
Yes, it does. If you don't have an implant, you will need glasses that are as thick as, I would say, a Coke bottle bottom, the bottom of the Coke bottle. They'll be as thick as that. And as a matter of fact, you won't find an optician to make up a pair of glasses for you like that. So they would probably be so expensive. And where would you even find a lens like that? So yes, implants are used.
Do cataracts return?
They never return. Once they're gone for good. However, the implant sits inside of your original capsule where your cataract once was. That capsule can get cloudy and require cleaning, which is done in the office. It takes about 5 minutes and you're good to go.
Like Dr. Barbour, I would like to add that I did have a cataract surgery. I had one eye done 1 week and the second eye done the second week. But the first time I had it done, I couldn't believe how blind I was. Everything looked extremely bright and defined. And I was thinking, all this time my vision was that diminished, but I think it happened gradually and I wasn't aware of it. And I've had the cataract surgery 2-3 years from now, and I use no glasses. I'm very pleased about it, but I wear sunglasses every day, winter or summer. Thank you, Dr. Barbour.
You're welcome.
Dr. Barbour, this is Deborah Jackson.
Hello, Deborah.
The laser assisted surgery that you're talking about to alleviate astigmatism, can that be done without doing the cataract surgery?
We can use a different kind of laser. This laser-assisted robotic surgery is done at the time of cataract surgery. If you just need astigmatism correction, then you can have LASIK or PRK.
Okay.
Mhm.
Yeah.
So that's how
Okay,
that
Doc, you just said PRK. I'm sorry. You can't be throwing acronyms. I gotta know what they are. I'm
It's
from
just
AT&T.
another, it's called photorefractive keratotomy, and
Okay,
it is to correct your vision as well.
okay.
So
One other
this
quick
laser
question.
that I'm speaking of chops up your cataract. Yes.
Another quick question on the implants. Are they focused for your vision, or are they the kind of implants that can be taken, have to be taken in and out? You just said that once you do it, you don't need it anymore. But does that correct the vision strong enough that you, as you get older, does it deteriorate and things of that magnitude?
No, these devices are permanent. So they're
Okay.
placed in your eye and it's permanent. They don't need to be removed or changed or rotated or anything. So
Okay.
it's,
Thank you.
works very nice. I'm going to move on and talk about dry eye syndrome, which a lot of us are suffering with. What are the risk factors? Definitely wind exposure, aging, hormones, computer and phone overusage, which we talked about. And a lot of people don't realize that systemic medications can cause dry eye too, like blood pressure medication, medications we use for cholesterol control, like your statins. Those can interfere with your tear production, believe it or not. What are the symptoms? Burning, pain, blurry vision, watering, and redness, of course. We start typically with preservative-free artificial tears. We may add some omega-3s. If you're still having dry eye symptoms, we would then move to our prescription strength dry eye medication, like Restasis, Cequa, or Xiidra. And we also have advanced dry eye management in the way of our dry eye spa, which is what we do in my office. It's called the one touch therapy, and we combine it with something called intense pulse light. The one touch therapy, as you can see, it looks like a pair of glasses, but they're actually these little foot plates that get really, really hot, and it goes right onto your eyelid margin, and it actually opens up the little pores in your eyelid margin to release some of the oils that may be trapped in there. And we combine that with intense pulse light, which basically does the same thing and reduces congestion in the lid margin. These two procedures combined, again, I say this is more of an advanced dry eye treatment approach, are very, very wonderful for patients. They feel so relieved afterwards, and they feel like they've gotten some kind of spa session here, and it is something that really, really works. So we've been putting together this combination of treatment with the drops, the omega-3s, and some of these interventional treatments for dry eye, and we've had a lot of success with that. So the last thing that we're going to talk about is keeping your eyes happy or having a happy look about your eyes. And what we do for that, of course, I couldn't end this talk without speaking about Botox and blepharoplasty and lasers, of course. So with the Botox, we can create a wide-eyed look. We can do an injection pattern that raises your brow or raises the lateral portion of your brow and give your eyes a little bit more wide-eyed look. With a blepharoplasty, the picture you see here is, blepharoplasty is actually a surgery that we do to lift the eyelids so that they do not touch the lashes and the lid margin. Some people, you know, of course, it's mostly aging and genetics that will cause this, have redundant skin of the upper eyelid, or they may have bulging of the fat pads of the lower eyelid. And so I do that kind of surgery, and it's done in the office. Some days we do, some patients will request all four lids be done at the same time, and because they just want to have that downtime all at once. And believe me, that does have a lot of downtime doing a four-lid blepharoplasty, but it's a beautiful outcome, a gorgeous surgery, and gives the patient a more youthful, happier look. Here's a video clip of a laser treatment that we're doing in the office of a patient who had some growths or little spider veins or little skin tags around her eyes. So we're using a CO2 laser here to burn those off, to make her look more youthful and happy. So I want to say, as we go forward to 2021, I know 2020 was just the toughest year and it's not even over yet. Keep your eyes healthy and happy. And always, it goes without saying, keep your vision on 2021. Keep your vision alive. Thank you so much, everyone. And if you have any other questions, I can entertain those now.
Dr. Barbour, this is Jenny Hassel. I just wanted to say that I am a living witness to some of the work that you've done with respect to making your eyes look more youthful with the laser surgery. You took tags from around my eyes and off my cheeks, and I can tell you my look is very different today from what it was when you began to work on my face. So thank you so very much.
You're welcome.
So you know I'm gonna put you on the spot, Jenny. Why can't we see your camera? Yeah, come on, you got to show us the product. I mean, I need to know what the product looks like. You said she did a great job. I want to put her on the spot now. Come on, Jenny, help a brother out.
I disabled my camera when I got on, so now I'm a rookie here. So I'm trying.
Okay, do you need me to help you? I'm the technology guy here, so you need me to help you now. Down at the bottom there, it has an opportunity where it says stop video and mute. And those two on your left, you just click that arrow and it shows your video.
Yeah, I know, but when I first got on, I disabled it. So Dr. Barbour knows exactly what I'm talking about.
So we're telling me we are having a COVID-19 moment.
Wow.
Dr. Barbour, can you please put your information in the chat for my personal information so I can reach out?
Oh, absolutely.
Thank you very, very much.
You're welcome.
Dr. Barbour, this is Wendy Kelly. I have a question regarding LASIK. I'm sorry I jumped on a little late. You may have answered. So I am someone who is definitely interested in LASIK surgery only because I do not want to wear my glasses or contacts. But my prescription is constantly changing. Is it something that I should look into or kind of, and I'm older than 40, so.
Don't let that leak out, Wendy. You look good.
If your prescription is constantly changing, I think it may require that you have at least 2 or 3 consistent outcomes with your glasses prescription before any surgery is entertained. Certainly if you're over 40, I would consider the lens surgery instead of LASIK. But if you choose LASIK, you have to understand that you will not be able to read after LASIK. You'll still need reading glasses. Some people are doing something called monovision where they leave one eye if you're nearsighted, and if you've been doing monovision already, that's a great option. But if not, I don't recommend it.
Thank you. I appreciate it.
You're welcome. Right.
Thank you, Dr. Barbour.
Thank you.
Lindsay, do we have any questions in the chat?
No, there are. We would like Dr.
I have one question.
Do you have an email? The email, but I can drop in the chat.
Okay, absolutely.
Okay. Yeah, I think I heard someone that had a question.
Yes.
Okay, go ahead.
Once you've had the cataract surgery, do you need prescription sunglasses or just regular sunglasses?
Large.
Most of the time, regular sunglasses are advised, and it's particularly with 100% UV coatings.
Okay.
Because you're still at risk from exposure to harmful UV rays.
Okay. Thank you.
You're welcome.
Okay, we're coming up to close to on time. So
Thank you.
I'm going to ask for any final questions for Dr. Barbour? Okay, hearing none. Dr. Barbour, I want to thank you so much for participating with the Black Chamber of Commerce. It's
Thank you.
Wednesday Wisdom. Again, for those on the line, this was the first of our Wednesday Wisdom Health Hour. So we
Wow.
will continue that into 2021. I want to thank Tracy, who is our newly hired chamber office manager. So wave Tracy. She's co-hosting with me today, and you'll see her on our Wednesday Wisdom sessions. I do want to invite you all to, well, I'll just say that this is the last Wednesday Wisdom for 2020. So we went out on a happy and healthy note. So thank you. But please look for our communications. If you're not getting our newsletter, please go onto our website and sign up, or you can contact Tracy or myself at info@blackchamberpbc.com or events@blackchamberpbc.com. But we'll kick off the new year with another Wednesday Wisdom Health Hour, where we'll hear from the renewed wellness. So stay tuned for that. And then on January 21st, we're going to collaborate with the Palm Beach County School District's Office of Small Business Practices and do a summit for diversity in construction. So again, my name is Keely Gideon Taylor. I'm the chair of resource development and events with the Black Chamber. Joining me is Tracy Thomas, our staff at the chamber. And so at this time, I am going to, again, thank you for supporting the Black Chamber and wish you a happy, peaceful, and enjoyable new year. We'll see you in January. Thank you.